Hello. So our group is working on what effect stress has on the nursing performance. My article that I found for the Qualitative Journal Club is Occupational Stress in Nurses Acting in the Care of Critical Patients. So the reason why I feel this article should be included in the paper is because it provides some groundwork information. It explains what types of stressors are causing the most amount of stress on nurses. This information can help kind of set the tone of our paper. The study also considers some bias statements like, nurses who are mothers have additional stress at home that transfers to the workplace. And the article also lists recognized stressors that contribute to occupational stress and categorizes these stressors. The aim and objective of this study was to identify the level of stress in nurses working in the direct care of critical patients. The study design was a cross-sectional study with quantitative approach. The exclusion criteria were that nurses had to work on a critical care unit for at least 6 months to be considered eligible for the study. The study group was a sample composed of 30 nurses who had worked at least 6 months on the critical care unit, and the study lasted from December 2014 to February 2015. Some of the baseline characteristics were the majority of the sample were female, about 76%, between the ages of 31 and 40 years old, and that's about 60%. 53% were married or living in a common law marriage, and 46% had at least one child. So some of the data and statistical analysis on the outline that I gave you guys kind of breaks it down a little bit more, but I'll just briefly go over it once my computer starts responding. We're going to have to pause for real listeners. I'm going to have to redo that because my computer froze. Alright, sorry about that brief pause there. My computer's back to working and it's quite print enough outline, so I'm using my computer for mine. Sorry about that. Okay, so back to where I was left off. Data and statistical analysis. So it's the Bianchi stress scale, I hope I'm saying that right. It was applied to assess the level of stress. This scale consisted of a questionnaire with data on the characterization of respondents and stressors of the nursing work. So basically, we categorized the stressors into 6 different areas. The first one was relationships with units and the supervisors. The second was activities related to the proper functioning of the unit. The third was activities related to personnel management. The fourth was nursing care with patients. And then the fifth was coordination of activities in the unit. Lastly, working conditions for performance of nursing activities. So participants marked the level of stress associated with each category from a value of 1 to 7. And then the stress level was calculated through the average obtained by the quotient of the sum of the items by the number of items marked as different from 0. Little mathematical calculation for you. So the results basically showed that 63% had a medium or high level of stress. And since this study is a cross-sectional study, we wouldn't necessarily generalize this to other nurses. So this means that we'll definitely make some additional research to further understand additional stressors involved with nurses on different units, as well as finding research that can help create strategies to decrease the stress in the workforce. Do you guys have questions?
So my question, what did you find most interesting about your article?
Actually, okay, so the bias statement that I mentioned to you guys about how women with children have higher stress because they have children, so that actually was found to be incorrect. Actually, it was parents had a lower stress, 3.72, compared to those without children, and that was 3.88.
Okay, so I had a question based on the results of the stress level. Was there any additional experiences that could have affected the results?
One thing I can think of is they did mention that nurses who had worked for 10 years or more, they actually had lower stress levels than nurses who were newer, which kind of makes sense. Experience.
Okay, so you mentioned categories. So what was the highest stress associated with it?
The highest stress was management and the workload. And the workload consisted of like 5 different things, performing activities with minimal time available, leadership projects on hand, nurse, like the meetings that they do for, like the nurse meetings that they do on the floor every day, noise level, and then like the physical work involved in the environment. So those were considered the highest stress. And then just so you know, lowest stress was actually the functioning of the unit. That's what they found was the least stressful.
Okay, I'll go next. So the article that I found was a quantitative research. It's called The Effects of Progressive Muscle Relaxation Combined with Music on Stress, Fatigue, and Coping Styles Among Intensive Care Nurses. So the reason I chose this article was because I thought it could be helpful in our research in regards of the solution that clinical practices can use to help reduce stressors that are caused by the exposure of stress on nurses. So I'm going to talk about a little bit on the background of the article. So according to the author, he was focusing more on ICU nurses because he believes that ICU is a very stressful atmosphere, and because of the complexity and the dynamic nature of their environment, in addition to high levels of stress, the other most common problem experienced by ICU nurses is physical and mental fatigue. Fatigue is a subjective system that most nurses call burnout in our language, and which prevents nurses from furthering practicing nursing. Considering the outcomes of previous studies that were found in nursing literature, there is proof that other non-pharmacological approaches such as meditating, breathing exercise, and yoga have proven to reduce stress and fatigue in nurses. However, the author is focusing on a new clinical study that combines two together. And in this case, it's progressive muscle relaxation with music therapy together. And he wants to focus if this can actually reduce stress and fatigue and coping styles among nurses working in ICUs. So in consideration of the long-term exposure to stress, chronic fatigue, and lack of coping styles among ICU nurses, he came up with 3 hypotheses. So the present study hypothesized that progressive muscle relaxation combined with music could reduce 1, mean stress, 2, fatigue levels, and 3, improving coping styles among nurses working in ICU. So the whole purpose of this study is to examine the effects of progressive muscle relaxation combined with music on stress, fatigue, and coping styles. So now I want to talk about the study design of this study. So it started off with 75 participants. However, they lost 19 participants in the process due to eligibility criteria. So in order to be in this study, you had to be 18 years old, had to have experience of at least 3 months in the ICU, and no documentation history of COPD, heart failure, or asthma. And other nurses left for other personal reasons such as maternity leave or changing hospital settings. However, there was exclusion criteria which consisted of history of severe psychiatric disorders or less than 3 months of experience in the ICU. So after that, that left with 56 nurses. 100% of them were all female. They were put into 2 groups that were randomized using the lottery method. So 28 were in the intervention group and 28 were in the control group. So in the intervention group, they all received a 20-minute session comprising progressive muscle relaxation combined with music for a total of 8 weeks. While the control group only received a single time face-to-face attention match education for 20 minutes, and no other intervention was conducted with them. They were just explained, how stress affects the body and what they could do to reduce that, but they weren't taking part in the intervention. So now I want to talk about the data collection tools used. So before starting the actual study, they all took part in a first interview, which they collected their baseline characteristics using a personal information form. They also used a perceived stress scale, and that measures the level of stress. So the higher the number, the higher the stress level the person has. They also use a fatigue severity scale, which measures the degree of fatigue. As well with this, the higher the score, the higher degree of fatigue the nurse has. They also use a brief cope, which measures the strategies used for coping in response to stressors. In this method, the higher the score means the better coping strategies the nurses use. So now, I also want to mention that all these methods were conducted by just one person, which is known to be the principal investigator. He was not blinded to the studies, which could be biased and what was mentioned in the limitations section. But now I want to talk about the results of the study. So stress scores in the intervention group decreased significantly at week 8 and week 12 with a p-value of 0.05. And then, as well as fatigue scores decreased significantly at week 8 and week 12 with a p-value of 0.05. The same was with the coping styles obtained. They were also significantly higher in the intervention group compared to the control group with a p-value of 0.05, making them all significant. Let's see, what else do I want to talk about? So let's just talk about the discussion of the study. So progressive muscle relaxation combined with music therapy appears to exert both short-term and long-term effects of reducing perceived stress. Significant decrease in the stress scores of ICU nurses can be attributed to the relaxation effects of progressive muscle relaxation in music interventions, which include energy restoration in the body and the reduction of autonomic stimulation. So limited studies have used non-pharmacological approaches to reduce the perceived levels of stress among ICU nurses. And the results of all the methods used have supported all the 3 hypotheses that the author has stated. Let's see, anything else I want to talk about? No. Do you guys have any questions? Did I miss anything?
I was just curious if there were like any additional tools used in the study that you didn't already.
So talking about the study tools, additional tools that were used. So the interventional group, actually, all of them had to be in an amphitheater at a research hospital. That's the place where the study was conducted. They had to wear black colored cotton eye patches to achieve the dimly lit environment. And then they were seated in a table where there was a laptop and a USB drive inserted where they would play relaxing music that was developed by a musician called Daniel Kabalika. The reason they used his music was because it contained elements of like rhythm, melody, harmony, and the tempo did not increase with the resting heart rate. Also, before the study sessions were started, the principal investigator would teach them how to perform progressive muscle relaxation, and they would have to perform it back to him in order for them to start the study. That's the only other tools used.
So you mentioned something about personal information form. What type of questions were included in that?
Let me find it. The personal information form was actually used as the baseline characteristics. Let's see. So they contained only 12 questions, and these 12 questions included like questions about age, gender, their educational level, if they were married or not, if they lived with family, friends, or if they lived alone, their income status, if it was moderate or high, also if they had comorbid conditions, which could affect the study if they did, and also how long they worked in the ICU. and then how many hours a week they work.
Okay.
That's the 10 questions included.
Okay, then my question, did anything in particular stand out to you from this article?
I guess the only thing that I kept thinking about when I was reading through the article is that they said they started with 75 participants and they were all female nurses working in the ICU. And I found that to be very interesting because, nowadays there's more male nurses, or it's about the same. So I feel like, a study containing the same amount of female and males could have probably had a different outcome. Yeah. I know.
Okay, so mine is a quantitative research. It's called Stress and its Impact on the Neurocognitive Performance of Australian Nurses. So nursing is a stressful occupation that requires continuous care for those in great need. Stress among nurses has shown to impair performance and nurse quality. It is very important for nurses to have optimal cognitive functioning for the determination of the diagnosis and treatment of patients. So this present study investigates the association between stress and cognitive performance using, I'm going to butcher this word, electroencephalography. So then I'm going to refer to it as EEG coming up, okay? And administered cognitive assessments. Nurses were recruited from their local community and private hospitals. I'll tell you guys how many a little bit later. So some of the trial purposes, so some points right here, I'm just going to mention a couple, but you guys have it in the outline. So according to article, consistent and chronic exposure to stress hormones can cause neuronal damage and death in the hippocampi and prefrontal cortex. Research examining the effect of stress has utilized numerous methods ranging from commonly used self-reported questionnaires like perceived stress scale and the Derogatis stress profile to objective biochemical markers like the hormone cortisol. And then I'll skip the rest, make it shorter. So it is hypothesized that experiencing higher levels of stress will be associated with 1, declines in cognitive performance, and 2, alterations in the brain activity as measured by the EEG. With regard to alterations in brain activity, it is expected that the higher frequency bands, beta and gamma, at the frontal component are most likely to be implicated. And like I said, this is a quantitative research which keeps data from the correlation of stress and cognitive impairment, which is kind of scary. The study group was 36 nurses, 34 females only. The mean age was 37. And I'm going to provide a little bit of more information about the EEG. So EEG data collection was divided into 2 phases. The first was a 5-minute baseline in which the participant remained in a seated resting state and eyes open with minimized outside stimuli. The second was an active phase where the participant completed a computerized form of the Stroop test. This format of the Stroop test repeatedly presented one of 2 options. The first matches the color of the ink with the color named by the word, and the second was the ink color deferred to the color named by the word. In both phases, participants were required to select the color of the ink as quickly as possible. This was used to engage cognitive process, which included a working memory, problem solving, task flexibility, and selective attention. And then for the data analysis, I'm not going to mention all of them because there's a lot, but of the EEG cognitive variables that were assembled, baseline frontal theta and alpha activity and frontal gamma reactivity were significantly correlated to stress. And then I'll put the numbers later. These correlations indicated that as participants' stress increased, theta and alpha EEG activities in the baseline resting phase also increased, and the gamma reactivity decreased. Interesting. This article is important because it goes into detail of the stress in nursing and cognitive impairment, and this uses lifestyle, cognitive, and the EEG to determine that.
Yeah, I think that'd be great to have like a body of the paper.
Any questions?
So what did you find most interesting about the study?
So this actually had a ton of information, a lot that I actually didn't cover because I just want to go faster. But I love that that it has the EEG actually to record the stuff, and what it measured was things like orientation, attention, comprehension, repetition, naming, memory, like all that was measured by the EEG. It's pretty cool.
What about the experimental procedures? You mentioned them briefly, but what were those?
Oh, yeah. Okay. So there was 4. So they used like recruitment from like the local hospitals, and then experimental tasks and procedures, and then the EEG data pre-processing, and then also analysis. So they used.
Was there any funding for this research study?
I think they said they were doing something. Sorry, my papers are everywhere. Okay, so this funding actually received no specific grant from any public, commercial, or profit sector. So no money.
And then my article was the influence of stress factors on the attention levels of a nursing professional. The study was performed in order to identify which stress factors, according to nursing professionals, have the most influence in attention process, and to determine which ones create the biggest impact on patient care. So it's assumed that stress interferes with levels of attention of healthcare professionals. So the importance of this is to determine which stressors that the nurses think are affecting them the most, because this ultimately affects patient care as well. The top 3 types of stress that were analyzed were environmental, psychological, and biological stress. The study aimed at 2 objectives. Number 1, identify, according to the reference of nursing professionals, which stress factors have the greatest influence in the attention process, and 2, analyze among the factors that influence the attention process, those that generate greater impact in the development of care activities. So this was a quantitative, descriptive, correlational study where the goal was to describe the connections among stress, attention, and nursing care. The study was conducted with a group of nursing professionals who worked in a university hospital in Rio de Janeiro City in various fields of practice, such as clinical and surgery hospital wards. The subjects had to respond to a questionnaire upon receiving or accepting to participate in the study. The study included nursing professionals in direct contact with client care, and it excluded nursing professionals who performed administrative services, did not perform direct patient care, and who referred to having any type of psychological changes in the past 6 months, because this could change, risk changing the impact of the investigational process. And the study was approved by the CEP, UNIRIO under protocol 526,388, and all subjects signed the consent form. So a demographic questionnaire and data collection instrument was applied. Several questions were prepared and their answers stratified like a Likert scale, which respondents answered questions in order of agreement. The data was stored in a database, PSPP, and measured on a scale of 0 to 100, where 0 was the worst and 100 was the best, in order to understand how much the stress factors interfered with the attention process. And the data was collected from 50 nursing professionals. So results from the study were that 54% stated that stress factors interfered with their level of attention in carrying out care tasks. 23 of the subjects didn't show any link between the level of attention and perspectives of stress. 55%, so 15 of the subjects stated that stress related to environment interfered the most with their attention and care of their patients. There's no p-value provided in this study, and basically the discussion and conclusion were that working in healthy and unsafe conditions influence directly on the physical and mental well-being of individuals. Stress and fatigue cause cognitive damages that intensify the risk and accidents in the states of different professionals. And the author concluded that it is essential to expand research into the subject and to establish parameters in order to increase the certainty of the data. They also stated that it is necessary to investigate the stress level of nursing professionals to widen the understanding of the connections of the level of attention and stress perspective, since they had assumed that stress influences attention and care of patients. I agree that they should collect more data from a larger subject study sample in order to gather more solid information and increase certainty of the data. So I picked this article because studies such as this one help us to better understand the connections between stress and patient care, and it's an important topic. I think that this article is worthwhile to add to the end of semester project because it really focuses on how stress impacts the daily lives of nurses and their patients. And that's pretty much it. Any questions?
You were talking about environmental, psychological, and biological perspectives. What are some of the stress factors included in the psychological perspectives?
Okay, so some of the stress factors included in the psychological perspective were duty conflicts, lack of autonomy, interpersonal relationships, dealing with death situations, fear of loss or failure or error, job dissatisfaction, client care, dealing with family, work overload, things like that.
Okay, so you mentioned a lot of interesting things in your article, but for you personally, what was the most interesting?
Okay, so the most interesting part of the article for me was the fact that environmental factors had a greater influence in the cognitive process of attention for this study group. But according to the rest of the literature that's out there, the majority of it shows that psychological perspectives are what influences the attention level. Yeah.
That's what I asked about that.
So I'm curious, as like a new nurse, and the stress factors that you were listing, which do you think would affect you the most, like right now?
So for me, I think the psychological would affect the most, which goes against what this article is saying, which they're saying environmental, because I think client care, dealing with families, and just ensuring that you're providing the best client care possible while still getting all of your tasks finished by the end of the shift is pretty stressful for me.
That concludes our first journal club.
Thank you very much.
Thank you.
Enjoy.